How does a small critical access hospital, remotely located in the Ozark Mountains, compete for its share of the healthcare market? Hospital X is determined to do so, and I am proposing an initiative designed to capture revenue and retain customers for skilled nursing and rehabilitative care. For a hospital to be deemed critical access, it must be located a certain distance from any larger full-service hospitals. In other words, it is critical for this hospital to exist for the safety of the community it serves, in order to provide basic acute care to those in the remote area. Critical access hospitals can have no more than 20 inpatient beds and must have an emergency department. Hospital X, however, also offers limited surgical procedures, extensive in and outpatient rehabilitation, home care services, and multiple outpatient clinics. It fills many gaps in care for the community. The caregivers are personally invested in the care because the patients are also their friends and family. It creates jobs both within and ancillary to the hospital. The key to this proposal, however, is the benefit of swing bed status. Swing bed status, awarded only to critical access hospitals, enables Hospital X to designate any number of their hospital beds as swing beds. Patients who have met discharge criteria but would benefit from some extended inpatient skilled care, such as reconditioning rehab or IV therapy, can be transferred to swing bed status, which is reimbursed by Medicare. A specific need that this bed assignment fills for patients who have suffered a stroke and have completed the acute phase of their recovery. When they enter the rehabilitative phase of their care, swing bed care is the perfect assignment for them. Hospital X wishes to fulfill its mission to always provide outstanding health care and its vision to be the best place to work, practice medicine, and receive care by providing appropriate care through swing bed service. The revenue generated will assist patients, employees, and the community. Its determined goal is to increase swing bed occupancy by 20% within the next year. Those involved in the completion of the goal are hospital administration, functional management, program promotion staff, and frontline caregivers. Administration will need to create and fully support the initiative. Management responsibilities will include educating employees, recruiting volunteers and champions, and monitoring success intermittently. Promoters in the public relations and advertising departments will increase visibility and community interest. Finally, frontline staff, the nurses, physicians, physical therapists, will both approach patients regarding what the hospital offers in swing bed care and provide the care that the hospital offers. Administrative goals are to collaboratively establish the vision behind the goal and offer needed support to demonstrate the value of the project. Goals for management include communicating with the frontline staff and assigning related tasks. Promotional staff will organize advertising and community outreach. Frontline staff will provide skilled care and apply direct marketing among inpatients and emergency patients. Administration will meet with representatives from all levels of employment to develop the vision and goal, and ultimately prepare a letter to each employee explaining the swing bed goal and its value within each scope of practice. Managers' tasks will include assuring that each employee learns the goal that has been established. They will develop policies and protocols defining admission criteria for swing bed and describing the admission process. They will provide ongoing training and motivation toward the goal. They will monitor individual staff success and offer assistance as needed. Pamphlets will describe the benefits of rehabbing locally. Local caregivers are more vested in patient care. Friends and family can participate in care more easily, and there are cost savings with less traveling. They will feature the skilled care provided. They can also showcase shining local employees and their award-winning director of rehabilitative services, recognized statewide as a star in his field. It will be touted that Hospital X provides therapy 7 days a week as opposed to the 5 days a week most facilities offer. Pamphlets can be placed around the hospital, in local doctor's offices and pharmacies. Local radio spots and billboards are available. The community is receptive to outreach efforts through local meetings such as the Senior Citizen Center, retirement groups, the Chamber of Commerce, among many others. Pamphlet details can include education about reimbursement as well. Direct marketing will be the most important element of the swing bed project. Frontline staff will be responsible for sensitively informing patients and families regarding the opportunities of swing bed care. They will be trained to recognize the patients for whom swing bed would be beneficial, to keep doctors informed of patient status, and to know the procedures for swing bed admission from traditional inpatient admission. It will fall to doctors to ultimately approach patients regarding swing bed admission. In terms of marketing for swing bed and stroke rehab, emergency staff will recognize and provide information to potential swing bed stroke patients in anticipation that they will choose Hospital X for their rehab services rather than those associated with the larger hospitals. On an ongoing basis, the swing bed project will be supported and evaluated for success. Managers meet weekly, directors meet monthly, and administration meets quarterly. Managers will monitor the data of swing bed occupancy and employee performance. Data will be compared over time and reported upward. Performance will be assessed, rewarded, and built upon through motivation. With 1 year, average swing bed occupancy will be increased by 20%. The organization will be rewarded with a more positive bottom line. More patients will be receiving excellent swing bed care in a setting that is enhanced by the involvement of friends and family, and the community will benefit from the revenue generated locally.